Hi James, nice to meet you. My name's Darren. I'm one of the junior doctors working here. I understand you're here because you're complaining of a rash, so I'd ask you a couple questions and see if we can find out what's happening. Is that okay with you?
Yeah, sure.
Could I get your full name and date of birth, please?
My name is James Smith, and I was born a long time ago.
Sure. Yeah. So I understand you're here with a rash. Can you tell me a bit about what you noticed and why you're here?
Right. So I've had this rash on the back of my elbows for a couple of months.
Right. Is this on both your elbows or one elbow?
It's on both. Yeah. Quite itchy.
Yeah, that can be pretty distressing. Does it look a particular color at all?
I mean, it's a bit red. Yeah.
Sure. And has it sort of grown? How did it first start? Was it in one elbow, then began in both? Has it grown in size?
I don't know, I just one day noticed it, but it was on both, and it's growing in size, I think.
Sure. Is it very itchy or just slightly itchy?
It's occasionally itchy.
Yeah. And have you noticed any sort of scaly, sort of flaky skin on it either?
It's a bit scaly, yeah, it's quite dry.
Sure. Has this ever happened to you before?
No, it's the first.
Have you had a fever at all?
No.
No, any like scratching or any injuries to both your elbows?
Not that I've noticed.
Noticed any kind of blisters coming up on the elbows?
No, they're quite dry.
And have you started any like drugs, new medications or drugs recently?
Not recently.
And do you know if you're allergic to anything?
I'm allergic to penicillin.
Sure. And you haven't had penicillin? Have you had penicillin recently?
No.
Sure. Any changes in your life in the past couple of months, both kind of socially and medically as well?
Well, work's been quite stressful.
What's been stressful about it?
My boss is really concerned about my performance. My boss is quite concerned about my performance.
Right.
It's just putting a lot of pressure on me.
Yeah, that can be pretty difficult. How are you coping with it at the moment?
Not quite well. I'm just feeling quite stressed out.
Sure. Would you like to see someone to help with that?
Yeah, that would be good, but I wish to sort out the rashes first.
Yeah, sure. We can work on both as well. I'll see what we can do about the rash.
Okay.
At sort of the 52-year-old age, we also look at some sort of screening in the past. Have you had vaccinations up to date?
Yeah, they're up to date.
Sure. Have you done the bowel screening where they send a test home and you put a bit of your poo in it?
Oh, I think I'm due for it, so I'll go back and do it.
Yeah. We'll do. Great. Well, thank you for your time then, James. That's all the questions I had. I'll probably complete some more examination and have a look at you, and then we'll see if we can figure out what's been going on. So ask for a relevant exam.
Say what you do, and then we'll give you the results.
Sure. So apart from everything generally, if I'm given a minute, I'd want to look at see the rash on both sides.
Sure. Okay. Yeah. So this is the rash you see.
Sure.
Is there any other examination things you'd like?
I'll check his joints as well.
Yeah.
Sure. And it is linked with some, so I'll ask him about like sort of eye pain. Look at his tummy abdo exam as well. Any abdo pain?
Not performed.
Sure.
So I just give you, on general inspection, well, not need distress, and ops works and stays like within normal limits and AFM.
Sure.
And then that's the right.
Yeah. Sure. So, James, I've had a look at the rash, and from what I see, I'm pretty confident it's a condition called psoriasis. Have you heard of that before?
No, not really. One of my friends might have it. I haven't heard much about it.
Yeah, sure. So it's a condition, kind of an autoimmune condition in a way, and it can affect your skin, but if it becomes kind of worsens, it can affect other parts of your body, like your eyes, your joints as well. So it can progress to be pretty bad, but at the moment it seems to be just on your elbows.
Okay.
Yeah,
Does this mean I will get it? Does this mean I'll have these things?
Oh, not necessarily. We've caught it while you just have it in your skin, and there's medications and treatments that we can talk about as well for that.
Right.
So how do you feel about sort of having psoriasis and learning about this now?
Yeah, I mean, I got to deal with it. I'm not really liking how it looks. It's, you know, what I do.
Yeah, it's definitely understandable. There are lots of treatments we have for them. So in the short term, I'll probably give you some antihistamines. I'll see if that can sort of help with the itchiness, and also some medications called keratolytics that might help with the dry skin and the flakiness of it. But those are kind of temporary solutions. The main thing I'd like to do is refer you to a rheumatologist just to check up on... actually no, I won't refer you to a rheumatologist yet. I'd like to run off some blood tests and check sort of whether your body is inflamed and having a lot of autoimmune processes going on. And then, yeah, see those results as well. Actually, I would refer you to see a rheumatologist because of this and how it can affect your body as well.
Yeah. Okay.
Yeah. And in addition to the sort of anti-itch and the flaky skin medication, I'll also give you some steroid creams and moisturizing creams as well, and they will help with the itch and with the kind of red appearance of it as well.
Okay.
So, do you have any questions with that?
Is there anything else I can do?
I know you're stressed at the moment. That can sometimes exacerbate, which may explain why this has come about at this point in time. So, are you open to having like a mental health care plan or seeing a psychologist? Yeah,
that would be good.
Sure, I think it will help sort out your work issues, but also help with reducing the flares of kind of this psoriasis as well.
Okay.
Sure. So I'll send off the referral to the rheumatologist, and I would like to see you in a week. So I'll start you on all this medication, send you off for them. I'd like you to apply them and see how you go with them, and I'll see you in a week to see how that's progressed.
Okay.
Sure. And please get the blood test done when you can as well. If you get kind of joint pain, there's no real big emergencies with this that require you to go to the emergency department. But if you get any joint pain, any eye pain, any sort of tummy pain as well, just take note of that and come back to see us in the GP clinic. Though sometimes if it can spread really quickly and cover your whole body. And actually in that case, I'd recommend you go to ED.
Okay.
Sure. Yeah, but you'll kind of notice and see it get really red and cover your body as well.
Right.
Sure, is that all okay with you?
Yeah.
So psoriasis is actually relatively, it is a fairly common skin condition. So I'll have a pamphlet here and I'll give to you, and you can have a look through what it may present like and sort of the ways you can help with it as well.
Okay.
Yeah. The final thing I like to add actually is sun exposure helps a lot with this. So if you're able to, you can go out in a t-shirt and let the sun sort of help with the psoriasis as well.
It's alright.
Sure. So medicines and
Exactly.
Yeah. So overall the medicines, get the blood test done that I will order. I'll send off the referral and they'll probably message you as to when to see the other doctor. And then I'll see you back here in a week. Sure. Yeah. Thanks for your time, then, James.
Right, thank you.
Well done. How did you feel like that went?
I messed up the management order. The management was a bit messy.
Yeah.
But I thought the other, the history was okay. I didn't look at this as much as I should have. I was just like, I got to take presenting complaints.
I think in terms of your history, I agree. I think you got all the main things. Like, it was a good history of the rash. Obviously, it's like the history for rash, so it's a bit funny because it's like in real life you just look at it pretty quickly. But but you've got the important questions to ask are, any redness, dry, itchiness, like those are kind of the keys, and then like you sort of try to quantify something very itchy or only just some of the time. And then if anything's brought on, that they know any like infective type symptoms as well is important. And yeah, so that was all fine. In terms of the examination, obviously, it's a bit of a spot diagnosis.
Can you move my thing? So he's in it.
Yeah, so it's a bit of a spot diagnosis. Again, the colour would help. I was too expected to print. But yeah, I think like that's pretty obviously psoriasis as well as the history as well as location. Like eczema is going to be more like on the inside of the elbows rather than on the outside. So yeah, that was all fine. In terms of your management, yeah, pretty good. I think just with the DK empires, so I think like you've both kind of rushed over the education bit a bit quickly.
Yeah.
So yeah, you've sort of said like psoriasis is like an autoimmune condition of the skin, and then you kind of then like jump, this is what we're going to do. I think in real life that's probably maybe a bit more okay, but in these kind of like OSCEs, you'll kind of also want to show the examiner, hey, I know psoriasis really well. Let me show you by telling the patient like those kind of things. So you know you can say things like, so what we've put here is, like, so what it is, chronic inflammatory skin disorder, whatever, usually presents with the red scaly rash. You can say, I think it's always good to like think, so like definition, epidemiology, risk factors, and then like signs and symptoms. So like for epidemiology, it's always, I think patients will always enjoy if you go, it's actually relatively common, we see it all the time. And like, if you know, like, you can kind of just say that, even if you don't know that it's like 2% of the population or whatever, like with something like eczema or psoriasis where it is relatively common, just saying something like, it's quite common, we often see it in people, of your age or something like that. In terms of triggers, so some of the things here, stress, which you picked up on really well in the history, smoking and alcohol, some of the other ones that were in the social history that you didn't touch on. In terms of symptoms, again, like, the rash, silver scaly rash, and then still in education, I always love to mention complications. So for this case, usually in most people it'll just be the rash. However, it can lead to issues with your joint and your heart as well, and that's why we want to manage it. And then it's a good segue into management, talking about complications. So like it doesn't, like, you could use any example. Like even in the previous one, hemorrhoids, normally it's pain, it doesn't cause any issues, but if you lose a lot of blood, it can cause issues there, and that's why we want to be on top of it. And then you can jump into your management again, like I said, start with non-farm, then farm and surgical if needed, not necessarily in this case. You did a pretty good job there. I don't know if you really touched on non-farm though, so like avoid alcohol, weight loss, stop smoking, those kind of things. Stress management you touched on really well, which was great. In terms of management, so I think your first line is going to be your topical steroids. Antihistamines are not as commonly used for psoriasis because itch is not actually that prominent compared to eczema or like an urticarial kind of rash. So it's more the topical steroids. And then some of the other things you can use is vitamin D.
What do you use? Vitamin D. Like calcium.
I think like steroids is your mainstay. Anything else above that, you can be like, there are some other things we can use if we can't get on top of it. I don't really know, like biologics. It's not really that relevant for a GP. And then, I think referral will be more to a dermatologist for psoriasis that isn't affecting the joints. I see where your head is going. But I think in this case, where it's a pretty obviously just like dermatological issue at this point, you probably refer to a dermatologist. But again, that's not too much of an issue. And then prevention, you did, I don't know if you did the sort of mental health care plan, but it's always good just go, while you're here, a few other things that we want to mention. Make sure like up-to-date your vaccines, like COVID and the flu. The other ones I've got here is like the cardiovascular risk, FOBT as well. I, like in preparation for OSCEs last year, I just like had a few age groups, so like your 20, 30-year-olds, 40 to 60-year-olds, and like elderly, like 64 plus. Just have a couple for each of those age groups that are relevant. So for your younger one, it's always vaccines. Younger people take STIs. Middle age, you've got like you start FOBTs or like CST mammograms for women, and then once you get older, like pneumococcal vaccine and those kind of things come into play, and all the other ones mentioned. Reinforce, you can again print out, and then follow up yours. Want to see how those things have worked, and then you sort of I think probably don't need to go into much detail of like if emergencies, just go if you have any concerns or it gets worse, come back and see me or go to emergency. Just because like that's probably the last thing you're going to say for timing more than anything. Good job. And like you had a very good tone and demeanour as well, very confident, which is always important.
Sure. Good, mate.
Alrighty. Keep going.